Okay, good morning, everyone. Hi, I'm Andrew. I'm the host for today. Today we are very happy to have Dr. Dr. Keong, who is a medical oncologist who sub-specialises in thoracic oncology, in particular lung cancer and thymic cancer. He worked at the National Cancer Center Singapore, Raffles Cancer Center, and now he's working for Curie Oncology, a private group practice. He was the lead of the lung cancer consortium project at National Cancer Center, who coordinated lung cancer research in Singapore, paving the way for many publications and discovery. Among his many achievements is his published work on clinical characteristics of lung cancer among never smokers. If not now, we will hand over to Dr. Ho for his talk today. Dr. Ho, please.
Hi.
Dr. Toast, please, sorry.
Yeah, hello. Hi, everyone. Yeah, I want to thank SAF for inviting me to give a talk during this No Tobacco Week. Okay, so my talk will be quite short, about 15 minutes. Then after that, we can have a question and answers. Okay, let me share my screen. Okay, so my talk will be on the health risk of smoking. Of course, you know this is No Tobacco Week. So, and because I'm an oncologist, so I treat patients with cancer. So my focus will be on cancers. Okay, but we know that actually chronic smoking can cause many other diseases other than cancers. So, for example, these are some of the diseases that can be caused by smoking. So like stroke, heart disease, atherosclerosis, so blindness, chronic lung disease, and reduced fertility. Okay. So other than cancers, the chronic smoking can cause some of these diseases. And then as for cancers caused by smoking, I think all of you will know lung cancer is the major problem. Actually, other than lung cancers, there are many other cancers that can be related to smoking. One of them is the throat cancers. Then you have the esophagus cancer, bladder cancers, liver cancers. All these are actually cancers where there's a higher incidence of smokers. Okay, so my focus will be actually mainly on lung cancers, but I will talk about starting with throat cancers first. Okay, so head and neck cancers, usually we talk about the throat cancers, where the cancer actually starts from this area, which is where the vocal cord is. So the voice box is this area. So this is a picture of the cancer arising from the vocal cords. So these are your vocal cords where the speech is. So usually patients will have they have hoarse voice. They suddenly find that they cannot people cannot hear them so clearly. Okay, and one of the thing about this cancer is that the treatment involves a very major surgery. So you can see patients who have these throat cancers. Physically, you can see that after the surgery, they will have a hole here. This is a tracheostomy. So they actually breathe through this, and then the air can also go in through here. Okay, so this is just to show you what are the consequences of having these throat cancers. But actually, this is because of the surgery to remove the throat cancers. But sometimes what is worse is after the surgery, when the cancer actually relapses, they can grow back around this area, and then it's actually quite disturbing because so like this patient, this area you can see quite dark because the patient had radiation treatment, but the cancer grow back again. So this is one of the problem. So it's best not to have this type of cancers and best not to smoke. Okay. So the throat cancers is more obvious. You can actually see physically. But lung cancer is, I mean, the major one that related to smoking. Okay, but lung cancer, usually physically you can't see the cancer. Okay, so like for example, this is the lung, and then this is the what I call the trachea or the windpipe. Then so the cancer is inside the lung. So physically you do not see. Okay, so I will just go through some facts about lung cancer just to explain to you for some of the facts and the myths of lung cancer. And then I'll talk briefly about lung cancer screening. So I guess I cannot get your response, but firstly, it's just a question if you guys know that what is the commonest symptom of early lung cancer? So is it a cough? Is it breathlessness? Or is it no symptom? So the answer is that it's actually no symptom. Okay, so I saw someone actually answered correctly. She must be paying attention. So no symptom is actually the commonest symptom of early lung cancer. Okay, let's start with some of the facts and or the myth. So lung cancer is the #1 killer among all cancers in Singapore. So is this a fact or is it a myth? This is a fact that lung cancer is the #1 killer. So this is the statistics. This is from the Singapore Cancer Registry. Yeah, so the sorry, someone wants to say something. Okay, so I just carry on. So if you look at the Singapore Cancer Registry, if you look at cancer registry, the among the men, lung cancer is actually the #1 killer among cancers. So over the 5 years, you can see 4,000 patients died from lung cancer. Among the women, lung cancer is the second commonest cause of death after breast cancer. So on the whole, between if you include both men and women, lung cancer is the #1 killer among all the cancers. Then how about the incidence? That means how many among all the cancers, what's the ranking of the cancers in terms of the chances of having the lung cancer? So in men is #2, #1 is colorectal cancer, and female is #3. After breast, colorectal, and lung cancer. Then lung cancer is #3. Okay, so then the second fact or myth is lung cancer is often diagnosed at a late stage. So is this true or not? Okay. So this is a fact. So lung cancer is often diagnosed at a late stage. So if you look at the data from the cancer registry, so we talk about stage 1, 2, 3, and 4. Stage 3 and 4 means the cancer has spread outside the lung to the lymph nodes or outside to other places. So this is called advanced cancer. So if you look at the stage 3, the percentage of stage 3 lung cancer is about 25%. But as it goes on lately, it's about 15-14%. But in terms of stage 4, it's about 60-65%. Okay, so that means for lung cancer, when someone comes to see us with the symptoms, almost 70-75% of them are actually late stage. That means the chance of cure is quite low if they come in late stage. So this is our Singapore registry data. But if you look at data from UK, it's quite similar. Even in UK or other places, the unresectable lung cancer is about 75%. To discover it early is probably about 25% of patients are suitable for surgery. Okay, so so lung cancer does present late stage. That means when they have symptoms, it's quite late. Okay. So why do they present late? So usually there's no symptom in the early stages. So For example, this is a CT scan of the lung. So you can see the cancer is inside here. This is an early stage lung cancer, but you will not know or you will not feel anything. So that's why there are no symptoms. By the time you have symptoms, the patient will be late stage. Okay, then what's the fact or myth number 3? Survival of lung cancer decreases with increasing stage. So this is a fact. Okay, that means if you look at this chart called the 5-year survival, so this is the staging 1, 2, 3, 4. So if you are diagnosed at the stage 1, your survival will be 90%, then it drops down. And if a patient has stage 3, the survival is about 30%. Once you're stage 4, the survival is about 10%. Also, so the survival will decrease if you discover it later stage. Then the fourth fact or myth is almost half of our lung cancer patients are non-smokers. So is this true or not true? So this is a fact. Okay. So in Singapore and actually in a lot of Asian countries, our never smokers with lung cancer is quite a significant proportion. So this is what we looked at, and I looked at the number of percentage of non-smokers. So previously in 1999 to 2002, about 30%. Now it's about 48% of our lung cancer patients are non-smokers. Okay. Okay. So, but this does not mean you can smoke. It doesn't mean that I don't smoke, I still can get lung cancer, so I smoke. So the risk of getting lung cancer is still higher for smokers compared to non-smokers. So this, if you look at this chart, and you may have seen this before, this is the risk of getting lung cancer. So as someone who smokes a lot, the risk goes very high. After 50 years old, it goes high. If they stop smoking, the risk will drop. And then this lowest one is the people who don't smoke. So the people who don't smoke, the risk is still lower than someone who has a chronic smoking history. Okay, so you still shouldn't smoke, even though non-smokers can get lung cancer. And the last fact or myth is smokers and non-smokers with lung cancer have the same type of lung cancer. Okay, actually this is not true. Okay, because smokers and non-smokers, their type of lung cancer are quite different when you look at the what we call the gene profiling, and so the treatment is slightly different between the two of them. So usually a chronic smoker will have black lungs compared to a non-smoker. Okay, so for example, in Singapore or in Asia, our smoking rate is quite low and our percentage of non-smokers are quite high. But in the US, the smoking rate is higher. So so if you look at this, I should have circled this. So in our patients, if you look at the different mutations, the gene change, we have a big group of patients with this thing called EGFR mutation. Okay, but in the US group, the EGFR mutation is quite low at 11%. Okay, so in terms of treatment, there are treatment that targets this EGFR mutation, and so there are some slight differences in the treatment because the gene profiling of the cancers are quite different. Okay, so in summary, okay, what I mentioned just now, so the most important risk factor for lung cancer is still smoking. Okay, lung cancer is the #1 cancer killer among Singaporeans. Lung cancer presents at late stage, and early lung cancer has no symptoms. Okay, and if your lung cancer is diagnosed at early stage, the outcome will be better.